First and foremost, I just want to thank you for reading this. I want to give a shout out to the people who've helped me, the ones who have checked and looked over some of this content, given me feedback. Everyone who supports this type of work, the advocacy we do through Culture of One, is part of this solution. And the reason I do this, look, I know, and I belong to the physiotherapy community. We have a great advocacy body in the Australian Physiotherapy Association. Unfortunately, this realm is a highly politicized. And honestly, I feel like in the political spectrum, we're relatively immobile as a nation. We are unable to achieve real reform. The last great Medicare reform was 1985 under Bob Hawke. So we're 40 years later. Just think in terms of how much technological change there has been in that time. We're now at the precipice where AI is literally changing everything. And over the next 5 years, we have to see an enormous amount of change in the Medicare system because fundamentally it is incredibly wasteful. We've seen in the last 12 months, 2 years, that they've managed to realize that GPs weren't even being held accountable for what is being billed. That's only happened in the last 12 months, and now they are forced to bill correctly and not over-service or overcharge people or charge people for multiple efforts. And guess what's happened in the last 12 months? The entire narrative has shifted to GP land is no longer sustainable. Well, was it ever sustainable, or were people rorting the system from the beginning? Who's to say? Controversial. I know. I'm just putting it out there. This stuff's been presented on four corners. This is not new information. But when we bring it all together, we've got to ask the question, who is this system built for? Is this system built to keep general practitioners at the center of care, being the gatekeepers and protecting themselves within this system? Or is it built for the Australian consumer? Shouldn't we have a system that is built to give direct access to the Australian public? Put the consumer at the center of care, give them access. And this is what the idea is with the digital Medicare wallet. It is literally the same amount of funding that has already been approved for every single citizen. Granted, not everyone is using this. And granted, the argument will be if we open this up, it's going to increase the amount of money being spent by Medicare. My argument is when we see these type of services delivered in the private sector, such as early intervention physiotherapy, where 4 to 5 sessions of physiotherapy is given to someone after an acute episode like low back pain, we actually see a massive reduction in costs. We see a reduction by giving early access to the right health professionals. We see a reduction in long-term disability. We see a reduction in adverse health outcomes. And most importantly, we see a reduction in days off work, which is fundamentally why we have Medicare. And this is why it's very hard to link these two things together, because it's not a linear link between access to healthcare and being able to stay at work, keep your job going. We see this in blue collar work, but the same applies. This is lost work hours across the economy because of this fluff, because you've got to wait days to go and see your doctor. That's why people turn up in the emergency room. That's why the emergency rooms are full, because people can't wait. A lot of people can't afford to pay the gap fees now as well. We're seeing the government through this election cycle throwing money at Medicare, promising to bring back bulk billing. They've been cornered by governing bodies like RACGP, like the AMA, Australian Medical Association, which is forcing the politicians to throw money into Medicare and specifically into a broken system of GP governance. What if we just opened it up? What if we just gave better access, easier access to all health professionals? Now, I know that there's going to be arguments saying that, perhaps physios, psychologists, not everyone should be a primary contact practitioner to begin with. I 100% agree. I think we need to police that in some way, shape or form. We need some level of ability to say, look, this person is more than qualified. And all it would be is a postgraduate test or something people can do online to get registered at a high level. Maybe that's where we can leverage our governing bodies like the Australian Physio Association to be able to say, look, these are the practitioners who we think have earned the right to refer onwards to specialist care, refer for Medicare billable imaging, refer to other disciplines, access funds which are meant to be available under the Medicare system to help people with their health. a lot of this gets lost in the message. We are not that far away. This is a 2030 system. If we have governments and a population that's actually interested in reforming this sector, I think there's appetite for this. I'd love you to share this content with as many people as you can and help get the word out. And let's start changing the way we do healthcare in this nation, because everybody benefits from it. Thanks once again for watching this video. Thanks for reading my content. I'd encourage you to download the full PDF document, because this runs through everything with all the quotes to give you a nice summary of what I've spent a good portion of the last 12 months thinking about in the lead up to this next election. So thank you once again, and I hope to see you on Culture of One sometime soon. Cheers.